problem. So now today I'm going to discuss about some prevention and management methods of common swine diseases in Sri Lanka. Actually, what I have encountered last 9.5 years with swine breeding farms. So I would like to share my experience with you all again. And so,
Dr. Sameera, still your presentation is loading.
Okay. Is it okay now?
Still not. Let's wait a couple of seconds.
Shall I stop my video and then share?
Yes, better, I think, yeah.
Yeah. Is it fine now?
It says that it's loading. Let's wait. All right, doctor. Yes, now it's all right.
Okay, fine. All right. Right. So, so let's share some prevention and management methods of common swine diseases in Sri Lanka, actually. So moving on to this presentation, again. Can't. Right. So how the presentation is going? Is it? Can you see now the second slide?
Still on the first slide.
All right. Is it okay now?
Not Dr. Sameera. Dr. Sameera, still
yeah,
on
Dr. Sameera,
first.
You can stop sharing and share it again. I think it will work now.
Can you see the second slide?
Okay.
Yes. Yes, Dr. Sameera, now it's fine.
Now, okay. Hello?
Yes, you can go ahead now. Yeah.
All right. Okay, right. So, so as a swine veterinarian, if the young graduates to become swine veterinarian, so definitely the vet should know about the management practices of swine farming. So he should aware on every aspect of swine farming, unless he or she will not successful in their clinical works, because it is important to have thorough understanding of how the pigs are behave and how they are behaved, like so unless in other animals, because they are under confinement. So you should know about their behavior aspects as well as their management aspects to have good good clinical skills to develop. So and so then only the veterinarian, he or she can manage the swine herd with a good understanding of their behavior, and with the balance of behavior, management practices, and other farm staff, and managing their clinical works, especially during outbreak conditions. And so it is important to keep in your mind, because the management practices are so much important in case of swine farming, and as a swine veterinarian. So and also, so it is and another fact is that I mentioned earlier. So pigs, you know that pigs are under confinement, and they exhibit their behavior to us. So we should know, and we have to know their normal behavior as well as abnormal behaviors in order to come into a good solution for their problem. So so the understanding of their behavior is to have a thorough understanding whether the animals are sick or whether they are good in condition. So if there are difficulties of managing, so definitely there are some issues there. So we have to correct them as soon as possible. Otherwise, the whole pig herd will affect with those tiny errors. So let's moving on to next slide. That actually the good health of pig. So mainly there are many pathogens inside farms. There can be. So if we provide them good welfare facilities, good housing facilities, and feeding, so definitely it will be helpful to have good kind of immunity development in the pigs, as well as, so we have to aware on the climatic changes, because so we have to provide them a comfort zone inside the farm. So then only, so if there are pathogens there, so definitely the animals will can combat them successfully under good management and good environment. So what I just want to highlight is here. So we call it as pig signal diamond. So you know that this is a kind of diamond-like thing, and especially the any pig should free from infectious diseases and other disorders and injuries. So, and also the environment should be peace and quiet. So every pig should have a resting place and comfortable microclimate to stay there comfortably. And there should be adequate light amount and duration is really important, because to excel their normal biorhythm, the light is really important. And now in Sri Lanka, I think this is not a big problem, because we have to 12 daylight, 12 night. And
Dr. Sameera, sorry.
Yes.
Still on the second slide, it's not moving. Have you moved?
Yes.
All right. Now it is on that important slide.
Can you see there?
Yes. Now that clinical works.
Okay. Can you see the diamond in the slide?
Not yet.
Okay. Now my slide is moving. Is it okay now?
Not. Still not.
Okay.
What you can do is stop slide share and again start sharing.
Okay. Okay. Can you see now?
Still loading. Let's wait few seconds here. Yes, we can see now. What you can do is you can go to that particular slide and start from there.
Which slide you can see now?
This is good health.
Good health. Okay. Okay. So now, so good health. So I talked about this before, because if you are managing your herd inside the farm, in pigs, they need to protect them from pathogens, especially because there are so many pathogens can be permanently there in the farms because the pigs are not going out, so they are still there, and if the hygiene is not well, so there are more pathogens inside. So unfortunately, there is some stress factor is there in the farm. So definitely they will get activated, and then they affect the pigs. So therefore the good management, welfare, housing, and feeding are so much important in the swine industry. So and there are environmental factors can affect the activity of pigs, because we should provide them good atmosphere. So if there are some conditions like heat stress or something like that, so definitely they will under stress, and obviously the pathogens can get activated, and then it will be more harmful for animals. So can you see this slide now?
Yes, Dr. Sameera, yes.
Pig signal diamond?
Yes.
Okay, so now you can see diamond. So this is called pig signal diamond actually. So the animal should free from infectious diseases as well as other injuries, and they should have what I talked last slide. So it will describe in detail here. So we should provide good peace and quiet for the pigs, and every pig should have a good atmosphere to rest and living comfortable and under good microclimate. So, and also they should have a good kind of light, adequate light for them to excel their normal biorhythm, and feed should be adequate, and every pig should eat sufficient amount of good quality food. So especially in Sri Lanka, so usually most of the farmers, they depend on swill. So we all know that. So if the feed is not good in quality, so it will damage your pig herd, because there are so much of pathogens there. And so in order to provide them, so we can boil it and then give it to them. Otherwise, if we don't have concentrate feeding, because nowadays we are facing so much of difficulties in finding concentrate feed. So, and the adequate water. So every pig should drink adequate quantity of water in good health, good quality. So so usually in pig farms, pigs drink water through nipples. So and nipples. So we think that the nipples are working, but sometimes those nipples can be obstructed, and then they can't drink adequate amount of water. So regular service is critically important in order to assure good water supply, and good quality water should be there. And also, if we provide water into a water trough or something like that, so that definitely water trough should be cleaned thoroughly. And because in pig farming, the hygiene is critical. If they are outside, if they are living outside, that won't be a problem because they are living with normal environment. Because so, but in under confinement in farming, so pigs have to face a lot of problems like that. So therefore, they are under stress. So if we can provide adequate comfort and adequate resource, they will have faced a lot of problems. And the other thing is the fresh air should be there, so the good ventilation should be there. If we are going to prepare some pig going to build a pig farm or facility for pigs, so definitely we have to consider the ventilation. That is critical. So if the pigs are overcrowded, so they will not feel comfortable, and there are a lot of pathogens can enter through airway, because they will cause a lot of damage to the pigs, perhaps the mycoplasma and other pathogens, PRRS. So some pathogens, there are so many pathogens can enter through airway, because if we do not provide adequate ventilation inside the farm, so that will be a huge issue. So and also the space. The space is a critical factor. So because I repeatedly say that they are under confinement, because they should excel their normal behavior inside the shed within a room. So everything is there. So like in jail. So we should provide adequate space for them, and resting, foraging, play. So defecation, there are some places, they are designated places for urination and defecation. So ultimately, all together can affect their health. So we have to consider these factors in order to provide them a good health condition inside the farm. So as veterinarians, so we have routine. We should do routine checkups. Otherwise, so a lot of problems can appear. So I recommend that twice daily monitoring during feeding is because if we can go 3 times a day, that is too okay. So that is provide good indications, and we can find many things when you are going inside farm, you're working. So if there are no problems, so even without problems, we can go there. We can go there and see whether there are issues with pigs. So the inspection is critically important, and during this inspection, so we should check their behavior and feed intake, activity, and alertness. And also we have to check the treatment and follow-up records, and breeding programs. What are the feed stuff available for feeding inside the farm, and any abnormal findings. So we should monitor, and we should look at those very critically. We have to analyze those things. And the routine inspection. So sometimes we do routine inspection, sometimes we do some disease investigations. And the routine inspection, we have to look at breeding program and plan all, and so what are the breeds available, and if there are records available. So definitely we should ask them to prepare or maintain records with treatments and weight records and other artificial insemination and natural service records, and details of mortalities and lab reports, and previous recommendations, whether they have been done or not done. So, and the one other thing is how the biosecurity plan is going. So we should analyze those as well, and the recent history of having some changes in management, feeding, and if we change our feeding program, so from where we get the feed, so those things are really important. So you can see a picture here. So you will see pigs are there inside the farm. So I think so some farms.
Dr. Sameera is still on the diamond side.
Is it okay now?
No, still not.
Okay, wait. Shall I check my connection and then?
No, just Dr. Sameera, again, stop sharing. Now it's the good health one, previous one.
Okay.
You have to go forward.
Okay. Is it okay now?
It's still loading. Let's wait. Yes, now it's right.
Oh, okay.
Yes.
All right. So this is what I spoke earlier, and so how is the second slide? Next one. Now we are in farm inspection slide. Is it appear in the screen?
No, this is not all right. Okay, yeah, routine supervision checkup list. Yeah.
Right. Okay. What I mentioned earlier. And how is this second? Next one.
Let's wait. Still the routine supervision checklist. Yes, farm inspection now.
Okay. So I moved on to the next slide.
Yes, continuation.
Yes, previous recommendations.
Yes.
Okay, fine. So this is what I mentioned earlier. So now you are in a picture slide with pigs. Can you see now?
Hold on, let's see.
Dr. Disnak, there's an option where you can keep slide without putting to full screen. Then
can you see the picture?
No, Dr. Sameera.
Okay.
You might try that Dr. Susanta's option. Keep as a not in the presentation mode, but as a
okay.
slide.
Right. Can you see now?
Yes, now the picture of pigs here in the pen.
Okay, you will see now. I will go with this option, right?
Okay, continue please. Yeah.
Okay. Right. So now you can see pigs in the picture, and this is actually so in pig farm. So it is better if we can see pigs from they are up, because if we are there in their top, we can see all of pigs in the row in the house, so at once. So then so some farms, especially this is actually in Oracale farm, so you can see there are pigs inside. So so they excel their behavior. Some are lying down, some are resting, and some are eating or something like that. And there are some places you can see here the pigs are they are the designated area of defecate, right? So you will see dung is there, the fecal materials are there. Not everywhere there is a place, and that is their normal behavior. So we can't see overcrowding there. So and it is really important that we can, if we can provide good atmosphere for them. So this is what we can see during our farm visit. So we can walk around and see whether they are doing good. So and also so you'll see some inspection going there, and so especially there's some pigs, you can monitor their feeding behavior, as well as there are some if there are some animals with some injuries with their limbs. So definitely we have to attend this immediately. So otherwise they will get damaged very quickly, and they will get probably they might die. So and therefore it is important to have good routine inspection procedure in order to prevent diseases. Especially the prevention is the best method. So otherwise, if we encounter with the outbreak, so it is a disaster. It will be a disaster. So we have to have good understanding of pigs, and definitely day by day, daily routine inspection is really important to prevent diseases actually. So then we can adjust if there is a problem inside the farm. So we can just daily, twice a daily, we can adjust them. So then only we can control disease, the appearance of diseases, occurrence of the diseases inside the farm. So when we are going, when we are walking, so we can see some problems. So you will see some umbilical hernia there, and so those are the important findings. So this small piglet can reject from others, or he or she has some competition with others to feed, and definitely the animal get stunted, and we have to separate it. So
Dr. Sameera,
now
sorry.
you will see
Again, we have a problem.
okay.
Still, we are on this. That's slide with pigs in the pens.
Is it moving now?
Not moving. Shall we do like this? You can stop sharing, then again
Okay.
start without moving into the slide share option. Keep it as a
Right.
list of slides. So one by one you can select and show. No.
Can you see now?
Still loading.
Is it appeared now?
Yes, Dr. Sameera, yeah. Let's keep like this and move. Without going into this slideshow mode, keep it like this, and you can use the down arrow key and move forward.
Yeah. Okay. Now you can see some see 4 pictures slide.
Yes, yeah.
All right. So so I described this earlier because so this is actually the routine inspection inside the farm. So the importance is, so we can definitely we can have a good understanding of pigs, so we can see their normal behavior, and we can find some animals if they have some problems with for instance leg injuries or lameness, or sometimes there might be some discharge from the vulva and all, and so you will get some discharge from like a purulent discharge from nostrils sometimes. So those are important factors, and if some pigs they can't eat properly, so those are the findings. So this is so important when as a veterinarian responsible for a swine farm. So now it is moving or not. I moved into a next slide. Can you see now?
And it's
The pigs are there.
still that number 10 slide.
Okay, I moved. Now I am in now the 11, slide number 11.
Number 10 is appearing on the screen still.
Okay.
Yes, Dr. Sameera. Dr. Sameera, you can proceed. Dr. Sameera, can you hear me?
Dr. Jisnagar, you can ask him to continue the presentation. We'll get some connection later.
Dr. Susantak, Dr. Sameera, can you hear me?
Yeah, we can hear you.
Yeah, Dr. Sameera. Dr. Sameera, can you hear me?
I think we lost the connection of Dr. Sameera. On behalf of SLVA, we are very sorry for that mistake, but we'll get into normal.
Sorry about the technical error. We are waiting until Dr. Sameera get connected with his presentation. I request from all of you to kindly wait few seconds. Thank you.
Dr. Malwarachi?
Yes, Dr. Sudan. I'm checking whether that Dr. Sameera is joining, and he has a connection problem, but I'm very sorry for the delay, and kindly wait for a few minutes and we'll start soon.
Okay, okay. Dear President,
Yes, Dr. Sudan.
yeah, if there is any huge problem in the power cut area, shall we conduct this webinar next time, another day?
No, wait 2 minutes.
Okay.
Dr. Sameera, if you are connected, now you can continue. I have uploaded your presentation as a PDF, so you can continue. He will be joining soon. Extremely sorry for the delay, and we'll continue like this. He will be joining, and from here I can move his presentation. So he will join again now.
So, can you hear me?
Yes, Dr. Sameera, yes, you please move forward.
Oh, okay. Can you move on to the slide number 11? So I just stopped there.
Yes, you can go forward.
Right. So sorry for the technical error and occurred, unfortunately. So now, so you will see now there is a piglet there. So obviously you can see this kind of animals when you are in when you are doing your routine visits, and so you will see some problems with herniation. So these are simple findings, but they are very important, because if you have this kind of findings, so you definitely need to separate those animals from others, and so it ensures that the adequate feeding for them, and so you will definitely you will find some best solutions if you go there and see whether there are problems like this. So next slide, please.
Yes. Yes, Dr. Sameera, you can continue.
Okay, so so what you see here is the stunted piglet. You know, there are so many causes for this. So especially the bone weakness, that usually the pig, the sow, they furrowed nearly around 13, 15, sometimes 19 piglets in their litters. So litter size, it depends on the litter size sometimes. So there are big piglets there. Because of that, so some piglets, they may not get enough feed and care from their mother, and so you obviously those type of pigs will get stunted in later, and so we need to foster them, and we need to have a good plan for them. So sometimes the litter the environment might be not good in good for early the initial stage of piglets, because they need warmth. So otherwise they will get weak, obviously, because of unhygiene and the cold environment. So the poor environment conditions and wet litter. So normally sometimes the diarrhea usually occur in these type of environments. So it is so you need to take this into your consideration, and immediate action should be needed to correct these type of problems, because you will lose money. If you find so much of piglets, something like this, so you will lose money because they will obviously will die in future. So next slide, please.
Yes.
Yeah. Now you can see the sow is get aborted. So abortion is happening there. So if you find many abortions, something like this at same location, so this is a clue for appearing some kind of outbreak condition, especially PRRS. So the routine inspection is critically important. So next slide, please.
Yes, done.
You will find some discharge coming out from the vulva, and this is kind of bad condition in sows, because the obviously the sow will get sick definitely if we do not attend. Can be seen something like this. So in order to go farm with more profitable way, so you should avoid this type of situations. So always the pig farming is going with money, and so you have to make sure that you are getting adequate amount of piglet, especially in breeder farms. So we need to attend those things immediately, unless we get some bad results. So next slide, please.
Yes, done.
Yeah, in this slide, you will see some purulent discharge coming out from nostrils, because so many pigs are there in the farm, in large farms. So if you have noticed these type of conditions, definitely, so we have to attend this immediately. Otherwise, so there are many respiratory diseases with pigs that they are really dangerous for them. So you need to focus on those during your routine visits. Next slide, please.
Right.
Yeah. So you will see a pig lying down, and you might see this piglet is normal, but you will see the cyanosed ears and purulent discharge coming from nostrils, and her backside is really cyanosed, and ventral side as well. So this is actually a really disastrous condition. So the identification of these type of cases are really important. Otherwise, you will lose a lot of money, and you will lose a lot of pigs from your farm. Next slide, please.
Yes.
So this is actually a picture. So you can see some decomposed fetus there, and another a good piglet with umbilical cord. So in case of some farrowing difficulties, so you will get this type of conditions, because the dead fetus, probably the dead fetuses might obstruct the delivery, the passage of delivery. So other healthy piglets can get died because of this. So because they are in a queue and they are waiting to coming out, and but the sow cannot expel out. So in this type of condition, so definitely we have to assist the sow. So otherwise you will get lost whole litter, and you will lose a lot of money, because the one piglet is so much of cost in case of having more profitability, but it really affects the farm performances. So definitely you have to attend those things, because so delivery process is critical, and the technicians or the caretakers should aware on how to handle, and the veterinarian should assist if he or she there. So you can't wait for 10 minutes. You can wait 30 minutes, 45 minutes to get next piglet. So if sow is delaying farrowing, so you need to assist her. Next slide, please.
Right.
So is it service to farrowing?
Outbreak should be controlled.
Okay. Can you skip that slide?
Yes, done.
It will come later. Now, which slide is there?
Service to farrowing.
Service to farrowing. So in breeder farms, you should have a good plan of having good farrowing process. So since the animal is so here in left side, you will get the day 0 days and then activity. So I summarized here the normal service that the day 0. So the routine activities that breeder farm should follow. So if animals are in proper management conditions, so definitely they will not get any problem, because we are planning to do vaccinations from day 60 to day 19, and the changes of feed which appears in the slide, and deworming. So we have to deworm them prior to at least 1 week before farrowing, and then we gradually reduce the feed supply in day 112. So and then the farrowing will occur in day 114. But if there are problems with sometimes dystocia may be there, so we have to assist them, and then this cycle should be continued when you are doing breeder farms, in order to have a good management practice. Next slide, please.
Right.
Yeah. Here, so here you can see the environment is not much cleaned, and it is dirty actually. So the sow is very close to the drainage, and you will see some pus coming out from the vulva, and piglets are there. So definitely this sow has a problem with farrowing, and because the uterus exposed to external environment, because usually it should be sterile. So So suppose there are some, there are 10 piglets are there. It takes around probably 1 hour, 2 hours, sometimes 3 hours. So to finish her farrowing, so a lot of pathogens can enter into the sow. So you will get some mastitis, metritis, galactia that commonly we know that the MMA syndrome. So you will get once farrowing finished. So this type of situation. So doing good management practices, we can avoid them, and so we can have good healthy pigs there. So this can help to reduce reduce the farrowing interval, and sometimes the sow might get die if we not intervene this properly. So, and some piglets may have died because the sow cannot produce milk as well because of this situation. The if the condition get worsened, the entire litter can die because of this. Next slide, please.
Yes, done.
How to prevent complication?
Yes.
Okay. So what we can do is, so there should be a plan for resting the farrowing pens properly. So once the sow is going to farrow, and so we are introducing sows to the new locations where the farrowing pens are there. So if because previous sows, when they are when we are planning to wean them, so definitely there should be a gap between weaning sow and then introducing a new sow to that particular place. So otherwise, there are a lot of pathogens are there. So we need to clean properly, and we need to disinfect it properly prior to introducing the new sow, at least for 1 week or 2 week interval. That is fine. So, and if there are a problem, earlier I mentioned that if there are problem with farrowing, so we have to assist the sow, and it's necessary to provide warmth for piglets, otherwise they will get die. And we have to make sure that the colostrum, adequate colostrum should be there with sow to feed piglets. If not, we have to foster piglets where necessary. So these are the critical things that we should keep in our mind in order to prevent complications during farrowing. So next slide, please.
Yes.
Yeah. So you will see two pictures there. So the bottom one is, so what is I spoke, I mentioned earlier. So we need to clean it properly. So, and disinfect it, and we apply lime here. This is a practical situation, what is happening there in Sri Lankan context. So actually, it is important to have a good resting, and the top one shows that the providing the warmth for any piglets with their mother. So you can provide some beddings, straw beddings, and some lights to get warm animals. So during the initial stages. So those are the key factors that I mentioned earlier, and what we can apply here in Sri Lanka. Next slide, please.
Right.
So this is actually a good environment. You will see the how much clean is there. So it is very so hygienically installed setup for farrowing. So if we can provide this type of environment, so definitely you will get good healthy piglets after weaning. So it is important to have a good consideration on piglet care and both sow and piglet care to ensure this. So the hygiene is the key factor. Next slide, please.
Right.
Right. So one the major aspect of maintaining good health in pig farms is a good biosecurity setup. So as veterinarians, we have to ensure that adequate biosecurity measures are being taken inside the farm. So therefore, if not, we have to take immediate measures to establish good biosecurity setup inside the farm. Otherwise, your farm will get affected with a lot of problems. So there should be a strict biosecurity control measures, and with you have to discuss with other managers as well and caretakers as well, because not only designing the biosecurity measures, but also we need to educate them, and we need to monitor it closely, and we have to assign personnels to monitor it, and it is very important. Next slide, please.
Right.
Yeah. So the goal is to set up a good plan to avoid entering pathogens into the farm, and so which ensures that no pathogens, or actually no, so very limited entrance of the pathogens into the farm. So that ensures the health and good health of the pig herd, and so this is should be a vital factor when we are working with pig farms. Next slide, please.
Yes.
Yeah. So let's see some the ways of getting pathogens into the farm. So you will get some contaminated vehicles and equipments, and some feral swines, sometimes contaminated feed, which I earlier mentioned. And now Sri Lanka is facing a huge problem with concentrated, and so people, they are usually given some swill most of the time. So definitely pathogens can come inside the farm with the feed. So we have to boil it out, and then some sick pigs are there. So if we purchase pigs from outside, so we need to have a good quarantine system inside the farm, and sometimes the international travelers, and so they can come up to the country. So we have to have a good kind of biosecurity measures in order to control them, and especially the contaminated clothing and shoes. So some people, they can work outside as well. So there is a chance of working outside in the farm with some, or especially piggeries. So if we go to other farm as a veterinarians, we are regularly visiting other farms as well. So we need to have a good understanding so how we contaminate the farm. So definitely we should aware on this, and we need to take good measures to avoid contamination of the farm. Next slide, please.
Yes.
Yeah. So in other aspects, you can put some notices inside the farm and outside as well. So then only we can have a good understanding for visitors. So they need to take some measures, and especially inside the farm, there should be a way of handling visitors, because there are possibilities of carrying pathogens inside the farm, carrying into the farm. So new boots and designated boots and overalls should be there to wear and also there should be some vehicle dips and all. So notices should be there, and also there should be a logbook to note whether they are from where they came, and to control control entering pathogens into the farms. So next slide, please.
Yes.
This is actually quite different thing. I think because earlier I mentioned that heat stress will be a problem for pigs. So you need to have a good heat control system. As Sri Lankans, you can find some kajans like things, and so we can put them in onto the roof, and we can cool them inside. So then we can have, provide good atmosphere for our pigs. Next slide, please.
Right.
Yeah. Is it an emergency or disease outbreak slide?
Yes.
Okay. So in case of an emergency, because in pig farms usually things are happening very smoothly, but suddenly the condition can get worsened, because if we do not have proper understanding of the method that we are going with the farm, so sometimes you will get some kind of disease outbreaks can appear suddenly. So what are the responsibilities that clinician should have at this when he or she is facing to this kind of situation? So the clinician actually should be open-minded, because he or she should not bias. So he or she should not depend on the farm staff, because they are telling us this has happened, and so suddenly this has happened, and something like that. So but we need to have a thorough and very detailed investigation on this, and therefore so we should be open-minded, not biased. So, and that the complaint, we have to assure that the complaint is clear, and also we have to go through the history and some critical factors, because whether they are we have to go through the vaccination records, and if there are some feed changes, we need to consider those, and some climate changes, because what I earlier mentioned is the preventing heat stress is really important. Some transitional period, something like that. So you get high humidity and temperature during April to May, that transition period. So you will get until you get rain, you will get very high temperature and humidity there. So this environment can be a problem for pigs. So definitely we have to have an understanding of climate changes and any breeding programs. So what is the breeding program there? So natural, sometimes some diseases can be transmitted from sow to boar or boar to sow. So if there is a natural breeding program going on there, so we need to take that point to come into the conclusion whether this is transmitting through intercourse or something like that. So, and also special gender affected, or so how is the waste disposal is going on, and the biosecurity measures are whether they are maintaining satisfactory or not, and whether if there is a history of having some incoming pigs purchasing outside, or people came from neighbor farm. So those factors should be considered, and based on these facts, we have to come to a conclusion, or we have to do a complete analysis regarding this situation. So next slide, please.
Excuse me, Dr. Sameera. Dr. Susantha, what's the time limit here?
We have maximum 20 minutes.
Dr. Sameera, we have only maximum 20 minutes. We have to fix with the time because it's a limited time package.
Okay. Okay. Right. So I have some slides to show. Can I avoid some slides and
Yes, we can
okay.
move forward. I think we can do fast.
Yeah, right. So next slide, please. So I will go faster. And so we have to analyze how many sick animals are there and the history of the situation, which I earlier mentioned. So any temperature fluctuations or any temperature, any sick, how many sick animals are there? So how is the morbidity rate and mortality rate? And also the frequent questioning is really important to get the understanding properly. So next slide, please. And so when we are doing examination of pigs, we need to have a protective clothes and adequate restraining methods. And the important thing is to do postmortem examinations. This is really important in case of pig. So when we are doing investigation on pig farms, so it is important to do some detailed postmortem investigation, and we have to, if there is, so we can't come into a conclusion. So definitely we should send sample to the laboratory. So, but during that time, there is a gap between results coming and appearing of the disease. So this time gap will damage the farm definitely. So definitely we have to have a good understanding of post-mortem changes, or especially the lesions for critical diseases. So definitely we have to, suppose now we are on holiday, so you need to have a good understanding of post-mortem lesions, and immediate treatment plan should be designed based on this until the results are coming. So the thorough understanding of post-mortem lesions for different diseases are really important. Next slide, please. And then we can design a treatment plan based on, sometimes we have to talk to experts and to get the conclusion or design a treatment plan. And the initial thing is to have a good awareness on gross pathology of different diseases, and so we can have a symptomatic and treatment, or so until the results are coming. Yeah. So next slide, please. The outbreaks should be actually controlled immediately, because pigs are under confinement, because they are really under stress, and because all pigs are there in the same place, so it can be transmitted rapidly among group mates. So it will cause huge economic losses, and also we have to protect the farm staff from mental stress. Suppose if there is a huge outbreak is going there, so they're really worried about this, and they have a unstable their mentality, and we have to balance those things as well while treating animals. Next slide, please. So pig diseases, some are infectious, some are non-infectious. So next slide. So
yes,
move on to the next slide. Next slide. Yeah,
yes.
you will see this diagram. So yeah, yes. So this is the one thing is the piglet diarrhea is the most common problem you will see in your farm. So the major issue is there, which is the unhygienic condition inside the farm, and there are a lot of bacteria, especially the E. coli. So, and they are permanently there. So if we do not have a good cleaning system or good biosecurity measures, so definitely we have to have thorough and good understanding of hygiene and biosecurity measures, the implementation of biosecurity measures inside the farm. And so there should be a good hygienic environment for piglets. And what I mentioned earlier, there are some necessary factors to avoid problems with piglets and sows, following sows especially. So next slide, please. The enterotoxemia is another disease which can cause sudden death of piglets. Actually, the cause is Clostridium perfringens type C. Can common in very early ages. You will get the whole litter dies. So the complaint is some piglets are circling, so they drink, they're very good in condition, but suddenly the piglets can get died. So this is because of enterotoxemia, and so some in most of the farms, sometimes you will get this type of condition. So next slide, please. Because the recurrence of the disease in infected premises can obviously see in pig farms. And the prevention method is, I think, the vaccination of gastrating sows at 6 and 3 weeks before farrowing with type C bacterium. So it gives some passive immunity, but I think that in Sri Lanka it is not available. But we can give some other things, providing adequate colostrum as soon as possible, some antibiotics as soon as born, and the good hygiene and some effective microbes can help us to reduce this type of conditions. Next slide, please.
Yes.
Here you get the postmortem picture which I captured during postmortem examination. You will find some hemorrhages in intestines, and from the piglet has died due to enterotoxemia. So next slide, please.
Yes.
This is another picture taken from piglet. So you can see the milk is there, but they drink milk very well. But once the piglet drink milk from their mother, so after few hours you will get this type of condition suddenly. Next slide, please. Actually, the prognosis is very poor in enterotoxemia cases. So you will get all animals get die. The affected animals definitely will die.
Yes.
Next slide. Yeah. So you will get. So I will briefly go through some diseases because so pneumonia and some problems like swine pox, mange, bone weakness, anemia. Sometimes the piglet can get died due to crashed, and those are some conditions with piglets actually. So we have to manage those things as well. Next slide, please.
Yes.
So in pig farming, you will find some causes: mycoplasmosis, Streptococcus suis, Haemophilus infections, gastrolysis, cystitis pyelonephritis, swine erysipelas, MMA, and some skin abscesses also you will get as bacterial diseases. So so these are some common diseases you will find in Sri Lanka. So common bacterial diseases. And so next slide, please.
Yes.
Yeah. There are some viral diseases: swine fever, foot and mouth disease, Japanese encephalitis, and PAO, PRRS, and porcine circovirus infection. And there are some problems with the hoof cracks and all due to some mineral and vitamin deficiencies can be seen in your farms, especially for breed animals. Next slide, please.
Right.
Yeah, I'll quickly go through these cases because these were some studies, and so you will see some porcine cystitis pyelonephritis complex and porcine reproductive and respiratory disease complex, Streptococcus suis, Haemophilus rhamnosus, and microplasma infections, tuberculosis, MMA, hemorrhagic bowel syndrome, something like that. Those are common diseases which I encountered during my swine farming as a veterinarian in swine farms. So next slide, please.
Right.
So one clinical case I can explain right now. This is porcine cystitis pyelonephritis complex. Actually, you will get some pyrexia. You know that the temperature is really high. So there is a phase of increasing temperature and up to 108 degrees of Fahrenheit. Then it gradually reducing, right? So the key is to identify whether the animal is in the rising phase of the body temperature. So if we found out that animal is in rising phase, because we have to monitor those animals so at least 2 times or 3 times daily, so we can monitor temperature. So you can use easily that infrared thermometer surface temperature we can get from outside from pigs, and so we can have an idea about whether the animal is in the increasing phase of the temperature, and so then we can give antibiotics, and then we can recover. If we find animals the gradually increasing and then decreasing phase, decline in phase, so there is a low chance of getting recovered. So this is actually critical. So the cystitis pyelonephritis complex is one disease which is, I think, in common in Sri Lanka. So you will lose a lot of animals because of this. So if we find very early stage, so you can recover those animals. Next slide, please.
Done.
I move on to the next slide. I can show some pictures and explain.
Right.
Yeah. So this is the ureter. You know, you see here the black arrow. You can see pus coming out from the ureters. So when you, because of this, so this is actually the pig which was affected from that cystitis pyelonephritis complex. Next slide, please.
Excuse me, Dr. Sameera, what we can do is we can move fast, and I'll email the PDF file to anyone those who want this presentation, so we can rush through the slides very quickly. Yeah.
Right. Yes. So you can go through the slides and you will see cystitis there. And this is the uterus. Next one. Metritis, pus, and hyperemia. You can see in arrowhead. And also some myocardial hemorrhages. can see from the arrowhead. And this is next one is the PRRS. You know, I will not describe this much, and I can show pictures. The PRRS is actually a disaster. We face a lot of economic. We had experience with PRRS in our farms in late 2019. It made huge economic loss for us. So, and also a loss for Sri Lanka as well. You can have the morbidity rate is really high, and you will get more abortions. And here, so please stop here for a moment. And so you will see cyanosed skin and cyanosed, and the nostrils filled with purulent discharge and abortions, and probably some metritis or pyometra or something like that for later cases. And you will get more abortions in your farm if you have a PRRS outbreak in your farm. Yeah, next slide, please.
Now I am in the post-mortem lesions.
Yeah, some post-mortem lesions in. So here you can get different kind of post-mortem lesions, because the PRRS is a viral disease, but sometimes there are some bacterial combinations also with secondary bacterial infections. So you will get some. So you will see the lungs and lungs there, and you can see kidney. So different kind of septicemic and other lesions can be seen when you are encountered with the PRRS lesion, PRRS disease. Yeah. Next slide, please. The only thing that we can do is the controlling and supportive treatment, because it is viral disease, so you need to support them with some supportive antibiotics and supplements via feed or parenteral you can give. And sometimes if you have diagnosed this as a PRRS, because you can stop opening your carcasses, because you can expose other pigs to the virus as well. So there should be a good way of disposing carcasses when you have this type of dangerous disease inside the farm.
Now we are in the Streptococcus suis infection.
Okay. Streptococcus suis, so both Haemophilus and Streptococcus suis, they have a similar kind of relations. You will get some peritonitis like this. Next slide. Yeah, some pleuritis and all. Some pericarditis conditions are there. Yeah, so we can have the Haemophilus, the diagnosis of, I must say that in Sri Lanka, the diagnostic aids are not much developed for swine diseases. So therefore, as a veterinarians, we should know the post-mortem lesions of those diseases. the Streptococcus suis and Haemophilus infections are really important. Like previously, we talked that PRRS and cystitis pyelonephritis complexes. So definitely we can give antibiotics like penicillins, and so what I did was, in our one of our farms, they get affected with this Streptococcus suis infection. So parenteral antibiotics like penicillin, benzyl and benzoyl penicillin combinations work well, and some NSAIDs we can give parenterally, and also the amoxicillin oral solutions can be given via drinking water with some acidifier. So we have to have a thorough and a very strategic plan to control this condition in order to control. Otherwise, the pigs will get affected and they will die suddenly because of this type of outbreaks. Next slide, please.
Yes, hemorrhagic bowel syndrome.
Yeah, this is another disease you will get, which the pigs died suddenly. So you will get some blood filled intestine, something like that, which appear in the picture. So the sudden death causes. So you can find these type of cases in your farm when you open up your carcasses for sudden death of piglets, something like this. Next slide, please.
Yes.
What is the slide?
MMA, mastitis mitralis.
MMA. I earlier mentioned that in the previous slide. So you will get kind of MMA, especially after 24 hours or 48 hours after crowing. You will get definitely MMA if the environment is unhygiene, and if you assisted with sow with dirty hands, or most probably the sow will get this condition. And so it is important to monitor temperature and give antibiotics. You can treat the sow with amoxicillin or some penicillins, and some supportive treatments like dexamethasone, and to ensure reduction, you can give some oxytocin and some supportive vitamins you can give along with these injections. Next slide. Pasteurellosis?
Yes.
Yeah, pasteurellosis is another disaster. Sometimes the opportunistic pathogens. So what I just wanted to highlight is if you have this dead carcass, you can simply make a blood smear from hard blood, and you can see under microscope. So, and the extracellular bipolar organisms can be seen, and then it is actually a rapid diagnostic method in field. So you should not wait until the reports are coming, because it gets delayed for a couple of days, probably 2-3 days. So you can take actions immediately with this finding. So the veterinary investigation centers, you can they have a microscope and other chemicals, so you can do simply the hard blood smear and see bipolar organism. So, and yeah, next slide, please. Mycoplasma.
Yes.
Okay. And mycoplasmosis, there are different organisms are contributing to have mycoplasmosis. One thing is respiratory type of condition, and other one is some lameness and all. So some mycoplasma species, they cause lameness, and so actually, so we can't eliminate mycoplasma from our farms, but actually we can control them through providing good hygiene and ventilation, and what I spoke earlier with pig signal diamond. So actually the control measures be there at every farm, especially the mycoplasmosis. And also if we get cases like mycoplasma, we can give some parenteral antibiotics like tyrosine, combination with some amoxicillin and penicillin antibiotics, as well as some supportive treatments. But there are some vaccinations are available, but every farm doesn't have this type of vaccination programs. But you need to have a good. Sometimes we can give some treatments, feed grade antibiotics like tyrosine or thylamicosine via feed or water in order to control this. Next slide, please. Vaccination program.
Yes, we are in the vaccination program.
Yeah. In Sri Lanka, usually we vaccinate against foot and mouth. The primary vaccination is given in 2 months of age, and then biannual vaccinations are recommended. And the PRS also, we priming is done at 3 weeks of age, and then the continue and the boosters we are giving usually every 4 months, 4 months apart. And swine fever vaccination also give. And now the JE is not giving at the moment, but sometimes you can vaccinate pigs against swine erysipelas also, so which is recommended biannual using inactivated type. Therefore, it is important to have a good vaccination program inside in order to control major diseases. Yeah. Next slide, please. So next is the deworming program. Usually we are practicing deworming. So with piglets, 2 weeks after weaning, with you can give Rintal with feed, and the sow is dewormed 1 week prior to farrowing. With you can give ivermectin, because ivermectin will helps to control mites as well as maybe or some problems are there. So therefore, the woman, that kind of problems can be solved giving ivermectin. And so at the time of weaning, we can give Rintal and some albendazole or something like that. And both usually both dewormed biannually. Yeah. So this type of deworming program can be designed for breeder farms. Yeah. And thank you very much for listening, and sorry for technical errors.
Okay. Thank you very much, Dr. Sameera Premarathne. It was a very informative presentation, and we had technical issues, as you mentioned, at the middle of the presentation. These days, we are experiencing so many signal failures, internet signal failures due to power issues, and I'm extremely sorry for that issue we face today. And if there are any questions, we can quickly take in, and let me check the chat box if we have any questions. I don't see any questions there. And I have, as I mentioned you, if you want the presentation PDF file, we can email it to you. You may type here in the chat box your email address. So we will email, because we had to rush through the presentation with the, because of the time limit. We had, and there's one comment or question. Let's see. Yeah, it's a comment. It's a comment from Dr. Nimal Jayavira. Yes, Dr. Nimal Jayavira, thank you very much. We will consider that your comment. We appreciate it. And if anyone want quickly ask question, you can just unmute your mic and ask, or you can use this raise hand option there. I think because of the time factor, we have to, we don't have any questions for the moment. And so with that, I think we have to wind up the session today. And as I said, it is a very good and informative presentation, and I'm very much thankful to you. And with that, I hand over this session to Dr. Chamari, the Secretary of SLVA, for vote of thanks.
Thank you very much, Dr. Visnaka. On behalf of Sri Lanka Veterinary Association, I would like to thank Dr. Sameera for accepting our invitation and doing a wonderful presentation today. Actually, it is a very informative presentation. Even though we had some technical problems, you might have spent a lot of time to prepare those slides, very colorful slides with practical actual pictures and all the details. So thank you very much again, Dr. Sameera, for being with us here today as the resource person. Next, I would like to thank Dr. Suned Disnaka, today's moderator and our vice president. Thank you, Dr. Disnaka, for coordinating today's webinar, and also being here with us as the moderator. Next, I would like to thank our president, Dr. Susantha Malavarachi, and all the executive committee members for being here with us today, and also for their continuous support to conduct the webinar series. Finally, last but not least, I must thank all the participants who joined from Sri Lanka and also from other countries. Like today, we had the president, Indian Veterinary Association, also with us today. So thank you very much, sir, for joining us today. And also, we had several veterinarians from India and also from Nepal and in other countries as well. So thank you very much for joining with us today. And I hope you will join in our future webinars as well. So thank you very much.
Thank you, Raj.